McMaster Monitoring My Mobility, or MacM3 for short, is a research platform at McMaster University focused on mobility monitoring using wearable technology. Mobility problems like difficulty walking or getting into and out of a car are common in older adulthood and can be a precursor to major health events like falls. Identifying changes in mobility as early as possible is critical to prevent major declines in health and social functioning with aging. Our multidisciplinary expert team is launching a large-scale research study in 2,000 older adults that will lead to the development of a novel mobility monitoring tool. We're calling this the M3 tool. The M3 tool will empower older adults and their caregivers to self-manage and monitor the most important aspects of their mobility as part of their overall health.
To gather data necessary for the creation of the M3 tool, we have created an app called Ivy that runs on any wearable device running Google Wear OS. Through this app, we collect comprehensive mobility information from our participants with minimal user interaction. Ivy is designed such that participants wear a watch throughout the day and then recharge it each night. Ivy collects raw sensor data, allowing researchers the freedom to perform an abundance of analyses using information from the following sensors: accelerometer, gyroscope, ambient light, heart rate, and location via GPS. Here are some examples of the mobility insights we collect using this data: step count, complete with time information of each step; activity recognition, or knowing the mode of travel such as walking, driving, biking, or sitting still; and activity intensity, which we measure as being light, moderate, or vigorous. Typically, mobility studies either collect activity data or location data. In some cases, both are collected but using two separate devices. With Ivy, a GPS-equipped smartwatch can collect both at the same time on one device. Ivy also encrypts GPS data to ensure privacy of participants. Using GPS, we unlock a wealth of spatial information about every participant. Some example measures we create include activity or life space areas, which represent the spatial boundaries of a person's day-to-day life, and trips and mode of travel, which gives an overview of how a participant chose to travel and for how long. With the spatial dimension unlocked, we gain a more complete picture of a participant's mobility. In addition to Ivy, we have also developed Clover, which is a Windows companion app to Ivy. Clover enables researchers to seamlessly interact with the smartwatch, making it easy to set up the watch for participants and to download collected data. With Clover, we can even perform preliminary checks to verify data quality. During our validation testing, we asked older adults to wear an Ivy-equipped smartwatch for 3 days. Here's what one of our participants, Dorothy, had to say about using the watch.
I found it very easy to put on, very easy to use. I didn't have any problems with it at all. I would wear it till I went to bed, which I would normally do with a watch. When I went to bed, I took it off and plugged it in.
The MacM3 study will use our custom-created Ivy app and smartwatch device to collect comprehensive mobility data every 4 months for 2 years in our 2,000 participants. Using the data collected by Ivy throughout our study, along with other health measures, we can then use machine learning and advanced statistical analyses to identify patterns of mobility changes with aging and their link to important health outcomes. Ultimately, we plan to use this information to develop the M3 mobility monitoring tool in collaboration with older adults and their caregivers. With the M3 tool, we can then help older adults by providing an early detection and monitoring system for reducing late life mobility problems.
We would like to acknowledge and thank our funders, including AgeWell, the McMaster Institute for Research on Aging, the LaBarge Center for Mobility and Aging, and the Provost Office at McMaster. We would also like to thank our industry and community partners, including Dixon Hall, Thrive Group, Additum Health, Hamilton Public Library, and our Older Adult Stakeholder Advisory Committee. For more information about our study, including our team, please view our website at www.macm3.com.